I wanted to determine whether in this highest risk group of patients, OMIDRIA could help with these issues. So I designed a study, IRB controlled, randomized, double-blinded, non-funded study where men on tamsulosin underwent routine uncomplicated cataract surgery. Half of them received no OMIDRIA in the irrigating solution, and the other half of the patient population had OMIDRIA in the solution. I was blinded to which group the patient was in, and every surgery was recorded both from the perspective of the operating microscope and endoscopically inside the eye. As a result, we were able to create a new grading system for iris flaccidity or billowing by measuring the peak and trough and the number of billows in a 5-second period as measured endoscopically inside the eye. And what we've determined with the results of this study, much to my pleasant surprise, was that there is a dramatic and statistically significant decrease in the patients who had OMIDRIA in the irrigating solution at the time of their surgery for reducing all three facets of IFUS. Iris prolapse was reduced 9.3 times less than the group of patients who did not have OMIDRIA in the bottle. Iris billowing and flaccidity was dramatically reduced in both its severity and its excursion, the amount of excursion or rise and fall of the iris, and pupillary miosis measured at 150 time points in the cohort of patients also showed significant maintaining of the pupil diameter, or in other words, helping maintain pupil mydriasis during surgery, even in this most difficult group of patients. Certainly, when I have my surgery someday, I will insist that the surgeon have OMIDRIA in the bottle. Now that we're in the 4th year of pass-through with this product, more and more peers have approached me, knowing that I use the product because I've published on this product, to say, what is my real experience? What's my locker room experience? Behind the publications and forgetting the lecturing on the product, how does it really work? Does it interfere with anything going on in the OR? Do the nurses have any pushback as far as incorporating it into an already busy morning? And I can tell you in all sincerity that what we've noticed in the surgery center is because of a lessening of potential complications, or certainly the increase in surgical time when we are working with the smaller pupil, the nurses have commented themselves that the surgery tends to move more quickly and more smoothly, taking less time in the eye. And this has been borne out by several of our colleagues who have done time studies to see that using OMIDRIA in the bottle compared to not using OMIDRIA in a bottle, especially in our high-risk patients, it definitely lessens operating room time. And of course, when we have a complication, opening a vitrectomy pack costs the surgery center hundreds of dollars, and as an owner of a surgery center, that definitely impacts the bottom line. So the opportunity to lessen the need for more instruments, opening more vials of viscoelastic, or in the case of a vitrectomy, potentially reducing the vitrectomy rate is a real cost saver as well as a real time saver in the OR. So I really enjoy sharing my experience with peers who are considering using the product. I know that if you use this product, you yourself will see, and one of the ways you'll see is that on post-operative day 1, these patients will still be somewhat dilated. That will tell you that we know how long this product continues to work even after the surgery. We know from studies that the ketorolac in the OMIDRIA maintains an IC50, or an inhibitory concentration 50, all the way back to the retina for at least 10 hours after surgery. So the opportunity to continue to benefit long after our surgical procedure is over is visible. But at the time and at the place that my surgical trauma is causing the inflammation, what I've seen as a result are whiter, more quiet eyes with less corneal edema, and better post-op day one visual acuities than before using OMIDRIA in the vast majority of patients. It's seamless for me as the surgeon, and yet I can see the benefit compared to the patients who were not receiving OMIDRIA, what an opportunity it is.